All right, so you're thinking about getting dental implants.
Okay.
That's great. We're going to dive deep today on
Yeah.
dental implants with some info from Elite Dental Tours.
Interesting.
And it looks like it's like a podcast or presentation or something
Hmm.
about dental implants and even dental tourism.
Oh, cool.
So let's just jump right in.
Yeah, I think a lot of people, when they think about dental implants, they're kind of initially focused on the, aesthetic part of it, like how they're going to look.
Right.
But actually, implants go way beyond just the look of your smile.
Uh-huh.
They actually mimic the function of a natural tooth root.
So it's about, not just appearances, but how your mouth actually works.
Exactly, yeah, restoring the actual mechanics of your bite.
Interesting.
So that's where the titanium posts come in.
Okay.
These are surgically implanted into the jawbone,
Right.
and they act as artificial roots for your new teeth.
And I think one thing that always amazes me about this is that the bone actually fuses with the titanium.
It is pretty amazing.
Over time.
Yeah, it creates this, incredibly strong bond.
Yeah, super strong.
Uh-huh.
Now, what about people who don't have enough bone for an implant? Is that a thing?
Yeah, that's a pretty common concern.
Yeah.
And, if there isn't sufficient bone, there are procedures like bone grafting that can actually help build up the jawbone
Oh, wow.
to support the implant.
Okay, so they can actually add bone if you don't have enough.
Exactly.
So it really is tailored to each person.
Absolutely. And that's one reason why the initial consultation and planning phase is so crucial.
Right.
The dentist really needs to take a look at your oral health, your bone density, and kind of discuss your expectations
Uh-huh.
to determine the best course of action for you.
Now, this source, Elite Dental Tours, mentions this 32 rule.
Yeah.
What is that all about?
So the 32 rule is like a fundamental guideline
Oh.
in implantology.
Okay.
And it basically refers to the spacing and positioning of the implants.
Gotcha.
So basically you need 3 millimeters
Okay.
between implant.
Between each implant.
Yeah. And 2 millimeters of bone surrounding each one.
So why is that so important? The spacing.
Well, it comes down to biomechanics
Okay.
and long-term stability.
Right.
Proper spacing allows for healthy blood flow
Makes sense.
to the surrounding tissues, which
Yeah.
is super important for osseointegration.
Ooh, that's a big word.
Yeah, that's the fancy term for the bone fusing with the implant.
Gotcha.
It also, minimizes stress on the implants,
Okay.
which reduces the risk of complications down the line.
Interesting. So it's not just like cramming in as many implants as you can.
Exactly. Yeah, it's a delicate balance.
Yeah.
And, the attention to detail is actually reflected throughout the entire implant journey.
Uh-huh.
So after the planning stage, then comes the implant placement surgery.
Okay.
And that's where the titanium posts are actually surgically inserted into the jawbone.
Now, for someone who's a little apprehensive about surgery, what can they expect during that phase?
Sure. Well, it is a surgical procedure,
Right.
but it's typically done with just local anesthesia.
And, many patients actually report minimal discomfort.
Really?
Yeah. And advanced techniques and technology
That makes sense.
have really made the process much more efficient and much less invasive than it used to be.
Wow, that's good to hear.
Yeah.
So what happens after the surgery?
So after the surgery, there's a healing period
Uh-huh.
of about 3 to 6 months.
Okay.
And during that time, the bone is fusing with the implant.
It's still crazy to me that our bodies can actually do that.
It's pretty cool.
Like integrate with titanium like that?
Yeah, for sure.
What happens if that doesn't work?
Well, implant success rates are high.
Okay.
There's always a slight chance that osseointegration might not be successful.
Right.
Factors like smoking or certain medical conditions or even just improper oral hygiene
Yeah.
can increase the risk of complications.
So even though it's pretty safe, there are some things that can go wrong.
Definitely. Yeah. It's important to kind of be mindful
Uh-huh.
throughout the entire process. Yeah. So what are those final stages?
So once the implant has fully integrated with the bone,
Okay.
then an abutment is attached.
And remind me what that is.
Yeah, so the abutment acts as a connector between the implant and the crown,
Okay.
and then a custom-made crown is placed on top,
Gotcha.
and that completes the restoration.
All right. So this source, Elite Dental Tours,
Yeah.
they focus a lot on dental tourism,
Right.
specifically in Costa Rica.
Yeah.
What are your thoughts on that?
Well, dental tourism is really interesting.
Yeah.
It's driven by, factors like cost differences
Yeah.
and access to quality care.
It's way cheaper, right?
Yeah, in some countries like Costa Rica, you can find highly skilled dentists, state-of-the-art facilities,
Wow.
and significantly lower prices compared to the U.S.
Like how much lower are we talking?
Sometimes up to 60% less.
Wow, that's a lot.
Yeah, it's a huge difference.
But I imagine there are also some risks
Of course.
involved in traveling for dental care. What are some things that people should be thinking about?
Yeah, you're absolutely right. It's important to weigh the pros and cons really carefully.
Uh-huh.
Um, Definitely, you want to research the clinic's credentials,
Right.
understand the logistics of travel and post-operative care,
Mm.
and, even consider language barriers.
Yeah, that's a good point.
It's also important to factor in like potential additional costs like flights and accommodation
Right.
and any unforeseen complications that might arise.
Yeah, that's true.
So there's definitely some things to think about.
So it sounds like dental tourism can be a good option for some people, but it requires a lot of planning and research.
For sure.
It's
Yeah.
pretty amazing how technology and globalization have opened up these possibilities
It really is.
for healthcare.
Yeah.
What do you think, listeners? Dental tourism, something you'd consider? It's definitely something to think about.
Yeah.
And as always, remember, this was just a starting point.
Right.
Always consult with a qualified dental professional
Yeah. Always a good idea.
to discuss your needs and get personalized advice.
For sure.
All right, till next time, keep exploring
Sounds good.
and stay curious.
Bye.
Bye.